Hi, my name is Kristen Lutz, and I graduated from Robert Morris with my bachelor's degree in 2015. Right after I graduated, I went and worked in the emergency department at UPMC Passavant as a bedside nurse. And during my undergraduate degree here at Robert Morris, simulation was such a huge part of it. It really taught me how to gain the confidence and the skills that I needed to care for patients at the bedside. And I think the greatest part about simulation is really that you have a comfortable and quiet place to be able to learn the skills necessary, and then whenever you get into real practice and doing the skills on actual patients, you feel prepared to do so. The other part that I loved about simulation is it really gives you the interdisciplinary team effect, where you're talking to physicians and communicating with the lab and really getting a feel for how that's going to be in real practice whenever you're communicating with other members on the care team. So it was really beneficial during my undergraduate degree. I then decided to come back to Robert Morris after I got a few years of experience in the ED, and I got my master's in nursing education through Robert Morris. And I'm now a clinical education specialist for the progressive care units at UPMC Passavant, and I use simulation just about every day in my current role. We use it for new hires that are coming in so that they're able to learn important aspects of their job in a safe and controlled environment, so that they are too able to take care of the patients that they're caring for. Simulation has been a huge part of my nursing career, and RMU has been a great place to learn the foundation of why simulation is important and really shaped me into the educator that I am today.
Hi everyone, my name is Jessa Pantages Hogue. I am a registered nurse, currently working in the psychiatry and mental health field, and I'm a two-time alumna of Robert Morris University. I graduated here with my bachelor's degree in 2017 and decided to continue on for my master's degree in nursing education with a concentration in simulation management. My experience during my undergrad time here at Robert Morris in the RISE Center doing simulation-based learning really encouraged me to actually pursue that to be part of my further career. I worked as a RISE lab assistant during that time and really got to see from both sides how simulation-based learning could impact a nurse's career. A lot of the time whenever I was working in the hospital, there were a lot of situations that I wasn't adequately prepared for, and then after doing simulation-based learning or learning different things in the Sim Center, I really did feel more prepared to do those things in our clinical setting. Some specific scenarios that I really remember during my undergrad time was actually during my psychiatric and mental health course here. I had been working as an aide in mental health during my time at nursing school, and there were a lot of times that we really didn't understand the pathophysiology behind the patients that we were taking care of, and after doing simulations I felt so much more comfortable in my own job and also in the clinical setting. After some of the experiences that I had in the RISE Center, I really thought about it post-graduation and knew I wanted to further my career and my education, and decided to go to school for nursing education. And I found out that Robert Morris was starting a new certificate program in simulation management. This further led me to be a clinical instructor here, and now I teach psychiatric simulation for the RISE Center. The opportunities that are given to students to practice talking to and interacting with psychiatric and mental health patients in this environment really does change their experience whenever they go into the clinical setting. I've seen it firsthand, the nerves that students will have the first week of clinical, and having that opportunity to talk to a real standardized patient in person in a safe setting inside of a simulation scenario really boosts their confidence and creates a really safe environment to practice some of their therapeutic communication and skills. I'm really looking forward to continuing to expand what we can do with simulation throughout nursing, and not just in this field but in a ton. I think there's so much room for growth and activity, and that makes me really excited about my future in the career and the goals of simulation, not in this program but in healthcare in general.